Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another edition of We Talk Health, podcast for West Tennessee Healthcare. Today we have Dr. Kimberly Burch. Dr. Burch is a pediatrician at West Tennessee Medical Group Hillview South Clinic in South Fulton, Tennessee. Dr. Burch, first of all, thank you for joining us.
You're very welcome.
Today we're going to talk about fever in babies and children. So I have just a couple of questions for you. I'm a mom, but I think that fever and temperature is a tricky subject sometimes. So I wanted to ask you and get your opinion on what we need to do when our kids have a fever. So first of all, what temperature is considered to be a fever?
Fever is considered to be any temperature of greater than 100.4. With infants, that should be a rectal temperature. That's what's best.
So how would you check for a fever?
Well, there again, with infants, rectal temperature is best. With a toddler, if you can get them to cooperate, a rectal temperature is still best. But you could also do the oral, under the arm. You could do the forehead. Older children, typically the oral is best. Oral is better than the forehead or under the arm. And a lot of people, what they'll do is they'll do one under the arm and they'll come in and say, well, the temperature was 101. Well, is that what the thermometer said? No, we added a degree. Mm-hmm. So whenever you do report a temperature, make sure you say how you took it so that the provider won't automatically add another degree and wind up doing unnecessary testing.
When should you seek medical care for an infant or child with a fever?
Well, when you have an infant who is 30 days of age or younger, and they have a fever, that's considered a medical emergency. Those children are at greater risk for blood-borne diseases and meningitis and things like that. So if you have a baby who's under 4 weeks of age, when they have 100.4 temperature, the best thing to do is kind of wait 30 minutes, uncover them, make sure they're not in a hot room, recheck that temperature. If it's still 100.4 or greater, you need to be seeking urgent medical care for that baby. When you have an older child over 1 month of age and they are still under 3 months of age, if they have another reason for having the fever, if they're teething, if they have an ear infection, they were just at their doctor's or something like that, 100.4 temperature is not that high. You can treat that at home. But if they start to go up over 102 and you can't get it down, go into 103, at that point in time, you might want to seek care.
Okay, great. So you mentioned treatment. How would you treat the fever at home?
To treat the fever at home, you can use cool rags, things like that first. Like I said, if the baby's bundled or if your child's in a hot room, get them to a normal temperature room, a cooler room. Sometimes you might have to use fans or something like that. That's always best if you can try to get it down that way. A lukewarm bath, what that would be is the temperature of the bath water is just a little bit below your skin temperature if you don't have a fever. And when you put the baby in or the child in, if it seems to be painful for them, their fever may be so high, you might actually have to warm that water up a little bit. And then as they get in it and they're calm, you can add more cold water, circulate the water so that it cools evenly, and that will help bring the temperature down as well. If those don't work, then what you can always do is give Tylenol. Tylenol is safe in any age patient. If you're under 2 months of age, what you want to do is make sure that your doctors approve that. For example, if you've had your baby's immunizations or something like that, or if you've been to the doctor and they already have diagnosed an ear infection or something and they've given you the okay to use Tylenol, then that's fine. Otherwise, they've got to be at least 2 months old before you use Tylenol, and Tylenol is best at that age up to age 6 months because it's safe at that age. You do not have to have any food on their stomach to give it. It won't upset their tummy, but what it does do is it makes them very drowsy. So you have to make sure you don't give too large of a dose. Many times the Tylenol bottles will say to give what I consider a double dose, and you should cut that in half.
Okay.
And that way the baby won't be so lethargic from sedation and can stay awake and drink and stay hydrated. The thing that people don't understand is you don't get dehydrated with a fever because of sweating. You get dehydrated with a fever because as your body temperature goes up, you breathe faster. In a normal day, we expire half of the fluid our body is going to release in our breath. Half of it is in the urine. So you think of how much urine you make in a day. Half of your body's water leaves as your breath. So if you have a baby who has a 1 degree temperature or 2 degree temperature, their respiratory rate really goes up quickly. And so they will very quickly become dehydrated. Whenever the child is 6 months of age or older, you can use ibuprofen. Ibuprofen, the only trick with that is they have to have something on their stomach or they will probably vomit. The good thing about ibuprofen is you can dose it the way it says on the package. It does not cause sedation. It lasts longer, 6 to 8 hours instead of 4 hours. And also, it works better. It brings down that temperature faster and farther. So that's how you would treat a fever.
Okay, that's excellent. Dr. Burch, this has been excellent information, and I think something that all families can use with their infants and children. So thank you for sharing this information with us today. You can find Dr. Kimberly Burch at West Tennessee Medical Group, Hillview South in South Fulton, Tennessee. The phone number for the clinic will be in the description. Thank you for joining another episode of We Talk Health.